I just don't want to go back and forth. And my patients won't appreciate that. So always gather your stuff that you possibly may need. Alrighty, so, by the way, any problems or anything that I need to know about before we test?
Not a great neck.
Okay, okay, then you're not going to be doing the neck.
Okay, yeah.
Why don't you lay, which side would you like to do?
I don't care.
Okay, why don't you face me?
Sideline facing you?
Yeah, sideline facing me. Okay. Now, it's actually very simple. Here, you want one? Okay. I like to give pillows just so they can be comfortable when they're doing this. Okay. Right. And we're going to be doing trunk lateral flexion. So you got the internal and external oblique on one side. Alrighty. And it's actually a very simple test to do. Actually, can you go down on like? Thank you. Alrighty. You want them completely side lying. Alrighty. Get their spine in a good position. Alrighty. Alright, and this is good for me. And honestly, I'm not going to be doing much at all except palpating and making sure he's doing the motion appropriately. Alrighty. Now, when you are palpating the obliques for lateral trunk flexion here, alrighty, they're right here. Right? When you're doing right on the side. Okay? Okay? Alrighty, and what you're going to ask them simply to do here, alrighty, can you give me a hand? Are you comfortable?
Yep.
Can you stabilize yourself?
Sure.
Actually, bring your legs back a drop, okay? You can bend the knees a little bit if you need to stabilize, okay? You want another pillow?
This is good.
Okay?
Here it gets in the way.
Alright, okay. Bring the knees back a little bit more. That's better. Alright, so you want proper alignment. Alrighty, and what you're going to have their arm at their side, you're going to have your bend your knees if you need to, okay?
Okay.
And all you're going to ask them to do is basically, I want you just sort of to pick up your trunk and slide your legs down. Slide your arm towards your knee.
Okay.
Alrighty, on the count of 3. 1, 2, 3. Alrighty, good, and back down. Okay? It's not a lot of movement, by the way, alrighty? Because it's basically he's not in a good position to do that. Alrighty? Now, if I ask when he's doing this, if you do one complete one, alrighty, and see what his range of motion is through the motion here. If he does 1, then he does that's a fair grade. If he does 2, if he does 3, it's a good grade. If he does 5, it's a normal grade. So it's the same thing as your ankle plantar flexors. It's the same thing as your ankle planters. How many can he do? So when I'm asking him for an actual test grade here, right, I just showed him the motion, right, and I want you to repeat that motion as many times as you can. Okay? So on the count of 3, you make sure his spine is in good alignment. You have your hands here, right, feeling for the muscle contraction, any fatigue coming out, okay? Because you know what? I ask him to do, say, he's somewhere between fair and, I'd say, yeah, fair and good. I noticed by the second one, he's like, a little quivery a little bit because he's getting tired. I'm going to take notice and see how he does on the next one. Is he not getting up completely as he did before the first time? Right? Because it is. Then I'm going to say, okay, you did it, all right, just relax a little bit. So at that point, he did 2.5 that were good. The third one, not so great, all right? So I'm going to be grading here somewhere in between, either a fair plus or a good minus. Because he didn't quite get to 3, but he completed the 1 that I needed. So that's going to that's going to tell me what kind of grade. Yes, there is a little subjectivity there, right? So that's why you always want to look at the motion, look at him. Does he look like he's fatiguing out? Alrighty, or is he struggling to do it? Alrighty, or holding his breath or anything like that. You want to make sure he's able to complete the motions. Okay? Alright, so on the count of 3, I want you to slide your hand down towards your knee and do as many of that type of motion as you can. Alright, or let me know if you get tired.
Okay.
Alrighty, on the count of 3, 1, 2, 3, and you count 1, 2, 3, 4, 5, 6, and if he keeps going, are you okay?
Yeah.
Then I know he's normal. I know he's normal at this point. I think key things to watch out for. Watch out for his arm. Make sure he's not pushing up with his arm. You do need his arm there. Basically, it's more support his head and everything.
Yeah.
Right? Ideally, you would probably want also one of those tables with the little hole with the special cushions and all that. Not all clinics have that. Right? But so this is fine. So just watch out that he's not using his arm to push up on, and you can see, you'll see his elbow coming into play, okay, and he'll go into some type of rotation, right, to push himself up, right? It's all coming from here, right? So that is your internal and external your oblique on your left side, okay? Right? If you were gonna test us of poor grade, can you turn on your stomach? Sorry, not on your stomach, your back to me. Scooch towards me. Oh, actually, no, scooch that way. You're correct. Okay? Alrighty. Same thing. You do need to take the pillow away. Okay? Alright? If he needs it. What you want to ask him to do, can you keep your arms at your sides? So, alrighty. Now, what I want you to do, the same motion now, okay, is just slide your hand down towards your knee. Your left hand down towards your knee. Okay? On the count of 3. 1, 2, 3. Alrighty? And I'm supporting his head so he's not just flexing too much. Alright? And this he only really needs to do one. Okay? Alright, this is a poor grade. Is it completely gravity eliminated? Actually, this one is. This one's a gravity eliminated one, okay? So remember, not all the time can you actually get rid of gravity. Alright, because then we call it gravity minimized. When we're talking about gravity eliminated and gravity minimized, for manual muscle testing, we're talking about the same thing, really. Right? Just the most position that where gravity is not going to interfere as much. Right? So that is trunk lateral flexion, right, in the poor position. Trunk flexion, okay. Right, scooch back over. You okay?
Yep.
Okay. You want your pillow?
No, I'm good.
You good?
No, I'm sure the pillow.
Okay. Alrighty. When you're doing trunk flexion, okay, what muscle are we testing? You can see it. Right there. Rectus. It's the whole rectus abdominis, okay? Actually, rectus abdominis should be the first one. Your obliques pretty much should be underneath. Your rectus abdominis is the primary one that we're looking at. Alright? And what part of your rectus abdominis? Inferior or superior part of it when you're doing trunk flexion? Superior part, okay? When you're having them do trunk flexion, you're honestly only going to be looking at the top part of your rectus abdominis. When you do trunk flexion for your lower part, complete trunk flexion, say if I'm standing like this, alrighty, it's going to be more your iliac is coming into play. Alright, so we're only going to be able to really test for the upper part of your rectus abdominis. I could show you guys how to do it later on, to test for the lower part, alright, but I'm going to hold you guys responsible just for the upper part. Now, whether we do it in a pure supine position or a hook line position is the 45-45 at the hip and the knee. It really depends on patient comfort. I honestly like to do it in knee flex because most of the time I'm doing it, it's on my patients. If I'm testing it, most of them have some kind of back problem. Right? If I flex them, the hip and the knee, this actually automatically puts them in some type of posterior tilt. So they're protecting their back a little bit, okay? If you don't have to go back into supine. If you're in a supine position, you're not totally in a posterior tilt, but you're not totally in an anterior tilt. But if you ask them to do a motion, okay, do an abdominal curl type motion here, you are definitely, if they have weak muscles, you're actually definitely going to have them do, they're going to go into an anterior pelvic tilt, okay? So to protect their back, I'm going to do it with them in knees flex. Okay? Some people in some books you'll see knees completely straight. When you're out on the clinic, it really depends on who you're looking at, okay, and what your CI says. Right? Now, when you're doing a manual muscle test for the trunk here, you also got to make sure you have strong enough neck muscles, cervical flexion muscles, and lower extremity muscles here, because they have to maintain this position here. And what else are you lifting, by the way? Your head. You got to lift up your head. So you got to make sure, Alright, they have enough strength in their neck muscles to go along for that. You're not testing your cervical flexion muscles here, but they are what? What are they basically doing to your neck?
Stabilizing.
Stabilizing. So you got to make sure they have enough strength to stabilize the neck, right? So it doesn't go flopping down. I've had patients years ago. She had some kind of neurological condition. I'm not really sure what it was, but it was one of those weird ones, right? But she just had low tones scattered all over the place, and she would go into some type of relapse every once in a while. And I saw a few times in the hospital. She had braces up the wazoo supporting herself, and she walked with Lofstrand crutches, kind of scary looking with the Lofstrand crutches too. And one time she came in, I don't know what she came in for some medical reason, but had a history of this neurological condition. It'll come to me later. Basically, she had no very low tone in her neck. Alrighty? And when I asked her to sit up, I didn't ask her to turn her neck or extend her neck or anything like that. She was just leaning, on the pillow. I asked her to sit up. I helped her sit up. She could not hold her head up. Kind of scared because it flopped over like that. I thought I broke her neck or something like that because it just flopped right over. So it is a good idea, if you're not really sure what they are, just ask them to sort of turn their head a little bit, right? Because it scared me because I thought I broke her neck or something like that. I said, okay. Why don't you lay back down now? You're scaring me. She was fine. I said, does that all the time. I'm used to it. I said, I'm not. I'm not used to that neck flopping. After she got over her medical conditions, it was probably pneumonia or something like that, she was fine again. She's just low tone all over the place. All right, so back to this. Okay, trunk flexion. Again, you're working on just basically using your hand position to grade the test, okay? So if you're having your hands out towards your side, alrighty, and you're gonna test for that's a test for fair grade. If you have your hands across like this, that's a test for good, right? If you have your hands behind your head, that's a normal grade. You don't even have to ask them to do as many as you can. It's the change in the position that will tell you the strength. So when you tell them to do abdominal curl, your instructions will be, I want you to slowly lift up your head and your trunk and slowly just bring the shoulder blades off the bed. Okay? And what position your hand is going to be in, their arms are going to be in, is going to dictate the grade that they get. Okay? So for a fair grade, okay, and tell them to do whatever they want first, okay? Yeah. Right? See what they do. Right? And then you can correct it a little bit. Right? So when you ask him to, since he's in this position already, alright, and you just bring your head and your neck and your shoulder blades off the bed, okay? Alrighty, and this is what he does, okay? Alright, you put down, alrighty. Now I want you to take your arms here, okay, and reach for your knees, okay, and do the same thing, okay? Alright, and that would be a fair grade, okay? See what they do first, okay? So this would be a fair grade. If he was going to do arms across the chest, keep your arms across the chest now. Alrighty? And try that motion one more time. That would be a good grade. Okay? Alrighty? And back of the head. Alrighty? By the way, back of the head like this, okay? Not like this. Okay? Alrighty? Slowly pick up. And back. Okay? And you also want to see, is he getting his shoulder blades off the bed? Alrighty? Now, if he did this, and he got his shoulder blades off the bed, okay, that would be a good. Alrighty? If he did this afterwards, and he got not quite, he only got the spine of his scapula off the bed. Okay, not quite normal, but better than good, somewhere in between. Okay? That's how you would judge. It's just like how you would judge when you're doing a manual muscle test and you're doing resistance, okay? You're going to see what fair is, okay, and how much resistance are you giving them before they start breaking a little bit, right? And that's going to give you judgment. Did I have to give a lot, or did they have to work a lot, right? Right? So that is for regular trunk flexion, which is your rectus abdominis, your internal and your external oblique. Okay? Alright. And for supine position here, alrighty. Now, if I'm going to palpate the muscles here, okay, hands right under the xiphoid, Okay, hands right under the xiphoid. Alrighty? And if he was gonna be doing a pour test, okay, you really can't sort of get them in a comfortable position. What would be a position where it's sort of gravity minimized or eliminated? Sideline. Kind of hard to do a trunk flexion motion in sideline, unless you're just going to curl up in bed or something like that. Alright, you just can't. Right? What you're going to ask him to do while you're palpating the muscles here, alrighty, hands at the side, alrighty, can you just bring the top of the shoulders off the bed, alright, and okay, and that would be considered a poor grade. Right? You just have them go a little small range of the motion, or you tell them, okay, alright, bring your head and your trunk off the bed. Right, and you see what they do. Alrighty, and you see if he only brought like the shoulders off the bed or just his neck off the bed, and you felt some contraction of the rectus abdominis here, then okay, it's a poor grade. Yes or no? Okay. Alrighty, so that's trunk flexion for poor.
You told them to tuck their chin at all, and
I asked them to do what they do.
Okay.
Okay.
Yeah.
When we get to thorax,
Okay.
okay, yes, they should keep their chin chucked in. Alrighty? Most people don't. If you go to the gym and you watch people work out, no, their neck is all over it's not all over the place, but it's very flexed. Their neck is supposed to be in a chin, what we call a chin tuck position, so it's stabilized and you're only working on these muscles here. Alrighty? Because when we'll learn more about it in ortho, you always want them to have in a neutral spine position. Alright? Yes.
Is it the same case for the lateral trunk flexion? So when he came up,
Yeah, he should be. Yeah. You should try. Yeah. You should try. You
So I
should try.
shouldn't be chin tucking.
You
I
shouldn't.
should
Well,
be-
no, that's not chin tucking.
Oh, okay.
Okay. You, people know what chin tuck is.
it's just
Okay.
Just keeping it normal.
Yeah. Mhm.
Okay.
Okay. It's more like a double chin, making a double chin on yourself. All right. It's not flexing. All righty. It's chin tuck is what we call cervical retraction. Okay. Just bringing it back. Okay. Just bringing it back. All right. It's kind of hard to do if you don't know what it feels like. Okay. It's an important exercise to do. Alright, for a lot of people who have cervical spine weakness, okay, and postural deficits, okay, particularly in your thoracic spine. Okay. Can you scroll for me, Eli? Thank you.
Say what?
Let's see. Trunk rotation, trunk hyperextension. Actually, we could probably, yeah, keep going. Okay.
Stop.
Yeah, right there. Yeah. Oh, wow. 3 of them, we're almost done. Alrighty, okay, trunk rotation here. When you're looking at your internal and external oblique, okay? Everybody remember where your mid-clavicular line is. Alright? Find your clavicle. Find the middle of it. There you go. And just run it down, okay? Run it down all the way down to your lower, past your ribs. Alrighty, so right here. Upper part right here, that's your internal oblique. Everybody remember where your ASIS is? Okay? Alright? That is where, alright, go right above it, is your external obliques are. Okay? Alright, and they sort of meet in the middle. They sort of meet in the middle. Okay? Because so they intersect each other. Alright? Alright, so you know which one you're actually doing. Tell you this, when you are rotating to the left, and that is this direction, this side, you're rotating to the left, you are using your left internal oblique and your right external oblique. Okay? So just think of internal first. Alright? If I say left internal oblique, left rotation, you're going to think left internal oblique and then the opposite one. Okay? Opposite external. Right? Right rotation here is going to be right internal. Just remember internal first. Right? And then you can exactly remember basically, which one it is. And if you want to look at it anatomically, your internal obliques run this way. Put your hands in your pocket. Hands in the pocket. That's basically the direction they run into. Your externals sort of run a little bit more perpendicular this way. Okay? Alrighty, so if I'm looking at the internal and external obliques for rotation here, Alright, it's gonna be graded same way as we do for regular trunk flexion. Hands out to the side, your hands are good position, it's gonna be adjusted a little bit. So for him, bring your hands up. Alrighty, if we'll do to the right, since we did a bunch on the left, your hands will be facing that way, okay? Both of them facing that way. Hands this way, okay, is for your good grade. Hands this way for your normal, okay? Same thing, okay? Alright, be careful, don't do this, alright? Don't grab your neck, alright, when you clasp. Up here, right above your, the nuchal line, alright? And your foramen magnum, right up there. Don't grab over here, because it's not going to be comfortable. All right? Right up here. Okay? I see most people do this. Yeah. Don't do that. All right? You're going to, they're going to hurt themselves. All right? All right. So, okay. Alrighty, so if I was going to ask him to do right rotation, alright, and I would want to just basically see what grade he is, I'm going to come again, ask him to, can you rotate your trunk this towards your right, okay? And he'll do something weird like that, okay? And that's okay. That's okay. Patients can do whatever they want, alright? They can do whatever they want. Now, I want you to take your arms, rotate them, have them face towards the right here, and I want you to rotate your trunk to the right, turn your trunk to the right, but try to lift up your shoulder blades a little bit, okay? While you're doing this motion. So on the count of 3, 1, 2, 3, lift up, okay? And and come back down. And what you're gonna watch out for is just the smoothest of the motion. Alrighty, we're gonna do it one more time, and I'm just gonna have my hands here. Alrighty, can you do it again? 1, 2, 3. Alright, and just make sure I feel the muscles. Okay? And down. Okay? What you wanna watch out for, okay, are they arching their back. Alrighty. Alright, you may need to sort of stabilize a little bit if they're arching their back. Because sometimes when you do a hook line position like this, it's just not enough, so you may need to stabilize a little bit. Watch what he does on the right arm. Is he pushing down to get him to rotate a little bit? Alrighty. If he's doing that already here, you're going to need to test for a poor grade. Alrighty, because if he's pushing down to get his trunk up, it's not that strong. So you're going to need to get him into a poor grade position, which is a sitting position. Alrighty. So, and for good, this way. Alrighty, we're going to do the same motion. Alright, and can you just sort of turn your trunk towards your right side, okay, on the count of 3. 1, 2, 3. Alrighty. Alright, and if we want to test, it's behind the head, okay? Okay, so, okay, okay. For sitting, can you sit up first, sir? Okay. Face that way. Thank you. Yeah, normal's just behind the head. Okay. You guys want to see that one or not? Yeah. That's just this one. Okay? Now, when we are going to be testing, okay, for trunk rotation for poor grade, what you want to do, keep your hands on your lap, okay? Right? Make sure they always have good sitting balance first, okay? Make sure, and they're sitting on their ischial tubes here. Alrighty? And simple thing I'm going to just ask them to do. Can you turn your trunk towards keeping your head in line with your spine, just turn your trunk towards the right side. Okay, on the count of 3. 1, 2, 3. Okay, this is trunk rotation in a poor position. Right? Right? Gravity minimized, not quite eliminated. Okay? I need somebody else because I need you off your head off the bed. So, why don't we switch?
Tag out.
Okay. Who wants to come up?